We're going to go ahead and get started. If anybody else wants to join, I'll just let them in. So my name is Cassandra Stewart. I am one of the department managers for the Counselor Education Department at the Chicago School. And presenting today, we have a PhD student from Palo Alto. Her name is Andrea Hanna. So I'll pass it over to her so she can introduce herself and go ahead and get started.
Thank you, Cassandra. Like she said, my name is Andrea Hanna. I'm from Palo Alto University. I'm in my second year of my PhD program. Prior to entering my PhD program, I did complete a master's in social work from the University of Houston. And after that, I worked for 2 years providing CBT to underserved populations in the Houston area. I primarily worked with the adult population, which is why I re-entered school, because I wanted to work more with pediatrics. So today, that's what we're going to be talking about. So I'm going to go ahead and share my screen here. Okay. So for today, I mostly prepared a poster presentation. So I'm going to go ahead and give an overview. If you have any questions, feel free to ask at any point. And
You're muted, Andrea. We can't hear you.
can you hear me now? Okay. So my presentation is on mitigating intolerance of uncertainty in pediatric patients with comorbid medical and psychiatric conditions. So intolerance of uncertainty is a transdiagnostic dispositional characteristic and is a normal reaction to ambiguous or unknown circumstances. So intolerance of uncertainty, basically normal for most people. It does become a problem when it is in very high levels in someone. So when you develop negative beliefs about uncertainty and its consequences, IU increases. So these are thoughts like the unknown is seen as dangerous or intolerable. So IU in pediatric health. So IU is a construct that is thought to underlay many psychological disorders, including anxiety. So IU is mostly seen in generalized anxiety disorder. It's also seen in social anxiety disorder, panic disorder, OCD, autism spectrum disorder, eating disorders. And they're doing more research and finding that it's also in depression. So mostly mood disorders. So IU acts as both a causal and maintaining factor by increasing vulnerability and negatively reinforcing safety seeking behaviors. And excessive IU is thought to cause and perpetuate maladaptive cognitive, emotional, and behavioral reactions. So what you might see in the cognitive area is indecisiveness, catastrophizing, rumination, or magnification of threat. In the emotional category, you might see worry, fear of loss or lack of control, or emotional distress in general. And in the behavioral category, you'll see avoidance, hypervigilance, reassurance seeking, and possibly disruptive behaviors. So when we look at IU and chronic medical conditions, we see higher levels of IU in chronic medical conditions, especially diabetes, asthma, and chronic pain. So youth that are diagnosed with these medical conditions are especially prone to developing health-related anxiety. And they're more vulnerable to the adverse effects of IU and may have higher levels of IU than the general population. And chronic medical conditions are also often comorbid with depression and anxiety. So we have IU, which is related to, more normal mental health issues. And then when we add in another factor, chronic medical conditions, we get just this very increased levels of IU. So it's very important in these populations where we have these youth who are experiencing both, who to pay attention to this because it can definitely negatively affect them in many ways. So what do we do about it is the big question, right? So most of the research has found that CBT is an effective way or the recommended way to tackle IU. So starting off, we have exposure. So this is geared towards pediatrics. So some recommendations for exposure hierarchies are the bubble up hierarchy. Basically, they put in their different exposure activities and then they bubble in, um, the level of fear for it. And then there's the fear thermometer, kind of the same thing. It's just it's a visual um, thermometer for them, and they do the same thing. There's other ones like a fear ladder that you can do with them. The next thing is behavioral experiments, so hypothesis testing. What do you think is going to happen? What are the chances that that's going to happen? And testing that. The next thing is cognitive restructuring. So that's very heavily with thought diaries. So a couple thought diaries that are useful to use with pediatrics are catching thoughts and feelings, or butterfly thoughts. They're basically modified thought diaries for pediatrics. The butterfly thought one that's really cute. There's like a caterpillar, and then the changed thought. It's a butterfly. Um, for that one, also, there's other things that you can do. There's like shake it off, where you write down the more negative thoughts on post-it notes, and this is something that you can do with more so towards early adolescence. But you write down all the negative thoughts on post-it notes. You put it on your body, and then you shake them off, and you come up with better thoughts. And so that's cognitive restructuring, mindfulness, breathing. There's tons of mindfulness exercises that you can do, and relaxation techniques, and then psychoeducation. So naming the enemy, and then there's a bunch of books for psychoeducation, and I can name a few of those. So the penguin who lost her cool. That's good with 5 to 8 year olds. And then there's the lion who lost his roar. And then what do you do when you worry too much? These are all things that you can use, books that you can use to help educate younger children on what anxiety and uncertainty looks like. And then also for parents, providing psychoeducation to them, freeing your child from anxiety is also a book that's pretty good for educating them. And that's by Tamar Chansky. I can type that in the chat if anyone needs the author's name. So these are all modular CBT is recommended to reduce IU in youth with comorbid psychiatric and chronic medical conditions. These are all techniques that you can use to help reduce that. Another part of this is assessing for IU, and the need for that, especially in primary care clinics, where we are identifying that people or that children are having mental health issues as well as chronic medical illness. So the Intolerance of Uncertainty Index A for children is a valid and reliable screening tool for IU, and you can use it to screen for that and also help you see as you go through treatment whether IU is reducing or not. So yeah, are there any questions that anyone has? No questions so far. So my presentation is very short. So what I can do is I can kind of go through some of the the techniques if you guys would y'all would like. What would be most beneficial, do you think?
I have a question. Could you just maybe detail what a scenario might look like when you come upon this with a child or adolescent, just so we can be familiar?
Yeah. So specifically in what kind of setting are you looking to work in, or do you work in?
Well, I'm a former teacher, and
Okay.
I'm transitioning into mental health counseling and hope to specialize in children and adolescents.
Okay. Okay. And are you hoping to be in a community clinic and like a medical setting? What would be most helpful for you?
Well, actually, I am located where St. Jude is.
Okay. Mhm.
So that was one reason why I was asking, because that's a
Yeah,
little bit different niche. So
it is. Yes. Okay. So in a medical setting, right, this would look like so for example, if you have a child or adolescent that comes in that's been diagnosed with diabetes, right? And they come in and they're glucose monitoring. There's fear of hypoglycemia, and so if uh, glucose monitoring is becoming easier with new technology and new ways for things to be monitored, but let's say that they have fear of hypoglycemia and they are coming in and they're presenting with anxiety symptoms. Let's say you give them the intolerance of uncertainty index and it's pretty high. So you know that their fear is based on not knowing what is going to happen if they have um, a hypoglycemia episode, right? So if that occurs, um, they're uncertain of what might happen. And so what you would do is with this child, right? You would um, either so obviously we're not going to do exposure because that would be dangerous, but with that we might do some cognitive restructuring. So what is the thought that's coming into your mind when you are constantly checking to see your glucose levels, right? Like what is the fear? What do you think is going to happen if your glucose levels are off? um and then doing thought diaries around that, right? So basically you're trying to tackle the uncertainty part of it to help with reduce that fear. Does that make sense? Okay. So with that, based on what age, right? Like if you have an adolescent, another part of it is um the parent, any age really, the parent also may have intolerance of uncertainty. So having that extra layer of, okay, so I have this child and I'm treating the child, but some of this intolerance of uncertainty might be stemming from the parent as well. So psychoeducation for both is super important, and then really tackling that with the child or adolescent through thought diaries. And then also regulation of the body through mindfulness to help with coping skills and whatnot. Does that answer your question?
It does. Thank you. When you bring up mindfulness, that kind of triggered for me. I actually have my certification in yoga and social emotional learning from Breathe for Change, and was really kind of searching, I'm going into my third year of the program, and how can I implement this? Because I feel like it's such a valuable tool, but this would most definitely be a place, especially the hierarchy you set up here kind of shows where that would really work and be beneficial. So no, that was great.
Wonderful. Yeah. Okay, so I see a couple more questions in the chat. So is IU more of a generalized anxiety / fear about the presence of a medical condition? What does this look like? The child also has comorbid anxiety disorder. Okay, so intolerance of uncertainty doesn't have to be just based on a medical condition. I am looking to go into behavioral health in like a primary care clinic or in a medical setting. So my interest is how IU affects pediatrics who have chronic medical illness and mental health issues. So IU is very much related to generalized anxiety and fear. And it doesn't have to be associated with a medical condition. We're just finding that, or the research is finding that when a chronic medical condition and a mental health condition are combined, intolerance of uncertainty is significantly increased. So that's why it's very important when a child or adolescent comes in to you and sees you, even if they're not in a medical setting, and you do know that they have a chronic medical condition, and then they also have a mental health condition, to assess for IU and possibly target that as treatment to help them. So what does this look like? The child also has anxiety. So I'm going to answer this with if they have comorbid anxiety disorder, right? Like you're still targeting that intolerance of uncertainty, whether it's just based on a medical condition or if it's based on a fear about something else. Does that answer your question, or Catherine? No. Okay, while we're waiting for Catherine, I'm going to go on to the next person. Oh, okay. So treatment would be focused on the fears either way. Yes. So whatever is creating that uncertainty. So let's say that, I'm trying to think of a situation like in a school setting where, for example, let's say that a child or adolescent is on a sports team and they don't know how well they'll do during a game or like their performance, right? So their fear, right, is not knowing if they're going to perform to the level that they want to. So that uncertainty around it creates all of these problems, like catastrophizing, right? Like, what if I play so poorly and I get kicked off the team? Or what if my teammates hate me after this and they're not friends with me? So that not knowing what the outcome is going to be is the thing that's creating the fear, and then disproportionately thinking that fear is going to create, a huge danger to them, makes it intolerable for them. So yes, the treatment would be focused on the fear that's creating the uncertainty either way.
So I imagine you saw in research, you would see a lot of this existing in reference to the children who went through COVID and the shutdown in school situations.
Yes. There's actually one of the references. It's a second reference.
Oh, I
On
see that now. Thank you.
poster. Yeah.
Yeah.
It's a second reference on the poster. And it's very much about COVID and what that looks like for children and adolescents who have experienced that.
I think we're still going to see that unfold.
Yes.
Because children, even this year, they were concerned about, should I wear a mask? Should I not wear? There's a lot of uncertainty around that. So I don't think we're going to see the full effects of that for a few years.
Yes. I completely agree. And the research is still, there's pretty limited research, honestly, about intolerance of uncertainty. It's still coming out and expanding. And especially around COVID, and why this is on chronic medical illness as well, is because during COVID, those kids had significantly increased intolerance of uncertainty, and now that everyone isn't wearing masks and they still have these conditions, right, what that looks like for them moving forward is something that I think we're going to see a lot of and need to assist with. Thank you for bringing that up. Okay, so Melissa, I'm going to get to your question here. Okay, so the IU index, I may have missed. You can find it. I'd love to see what questions are on there. It's a screener for IU symptoms, right? Yes, it is. And I put the reference for it. It's reference number 3. And I'm trying to remember if it was on this reference, the actual screener. Let's see. Find it. Let me bring it up for you. If anyone wants me to email this poster to them, you're more than welcome to put your email in the chat, and I can send you a copy of it. That way you don't have to try to screenshot it or whatever that may look like. So if you'd like me to email it, yeah, just put your email in the chat and I can email that to you. You know what? It was not that is not the reference for it. Okay. I will also, if you see, where did my chat go? Oh, here we go. Okay. Melissa, if you want, I can email you the article that had the index information. There's actually more than just this one, but I liked this one the best based on the population that I work with. So I can email you that information for sure on the index. Does anyone else have any questions about IU about any of the modular CBT, anything like that. So what might be most helpful for y'all? Do you want me to go through more of, like show you a bubble up hierarchy, a fear thermometer? Do you what would help y'all most? Can you share more about specific interventions you use? Yeah. So specifically for IU, is that what you're asking about, Catherine? Yes. Okay. Um, so these these CBT interventions are the ones that are most used. I'm a CBT person, so I'm pretty strictly CBT. So these are the ones that I would use. As far as where I would start with psychoeducation, then go to mindfulness, then cognitive restructuring, and behavioral experiments and exposure. I think what's might be most effective is exposure, but leading up to that exposure and giving them the skills that they need to be successful in that. So if you look at the triangle here, starting off at the bottom and working your way towards the top, knowing that the top is probably what's going to be most effective. So earlier I talked about the shake it off technique for cognitive restructuring. Let's see. As far as psychoeducation goes, I listed a few things. I don't know. Do you have a specific question about like which module you'd like more information in? I think that was Catherine. Exposure. Okay. So as far as exposure goes, so when I work with exposure, I never, push the child or the adolescent to do what I want, if that makes sense. It needs to be very much like what they're willing to do. It needs to be very collaborative when you're creating the hierarchy. You're never pushing them to do something that they're just totally uncomfortable with. So I actually let me see if I can somehow. I have I have an example of a bubble up hierarchy. It's just not on this screen, so I'm wondering if I can somehow show this. Um, okay. I don't have the bubble up one, but I do have the I have another one. It's called the feeling pain thermometer that I use. So let me stop sharing for a second and let me reshare. Um, do you see the thermometer? Yeah. Okay. Okay, so this is something that I would use with a child who has chronic pain or pain, right, who has a medical condition, and it can be used not just for pain, but that's my area of interest is with pediatrics with medical conditions. So you could use this as a hierarchy also. So at the bottom, right, you're going to start off with the lowest level, the lowest activity that causes the lowest level of fear. So at 1, right, let's say for example, there's social anxiety, right? And so maybe at 1, you do some role playing with them, and then at 2, maybe they do some role playing with their parents. Um, at 3, you might do some maybe like virtual interaction with another child, um, or maybe on the phone, right? And then at 4, you might do it virtually through a video game where they're not really seeing the other kid, but they're like talking to somebody. At 5, they might have, a play date with somebody, like one-on-one. And you continue to go on, right? Like, and that's based on whatever the child's fear is. So if they have a lot of fear or a lot of intolerance of uncertainty, you're going to start off with something that's just getting them to like visualize, right, what that looks like for them. So imagining having a social interaction with another child, and then you work your way up to full exposure, right, like actually interacting with either another child if the fear, like one other child if the fear is really high, or multiple, right, if it's however that looks for you. So this is something that you can do that visually like helps them. You can have them color it in. You can have them make it their own, right? You want it to be fun for them. You want it to be very, very interactive for them to do this. You can also do this with like a ladder. People get very creative with it. And the more interactive it is, the more they like to do it. Is that helpful? As far as exposure goes, let me see there. Okay. Can you share some of the child appropriate language you would use with 5 to 11 young children? Okay, so yeah, so intolerance of uncertainty is not something that you have to. Let me stop sharing here. Okay, so intolerance of uncertainty is not something that you have to name for the child, but you can say, not knowing what's going to happen. I think for, around 10 to 11, I think they'd definitely know what uncertainty is. So around that age range, you can probably use uncertain, like towards the lower like 5, 6, 7 age ranges, you're probably more using language of like, you don't know what's going to happen, right? We're afraid that something might not turn out in a good way and it's scary. um it feels dangerous to us, that kind of thing. So I think the 5 to 11 age range could be broken up a little bit more, as far as I would do it. Let's see, how would you empathize with their experience? Yeah, I think I think it depends on the kid, right? I think, and the age. I think tone, body language, showing that you're there for them, that they're in a safe space, um, showing them that it's okay to be afraid, right? Like intolerance of uncertainty is a normal thing for people. It's just when it's in excess that it becomes a big problem. So I think normalizing that for the child and letting them know that it's okay, and that you're there with them, and that you're going to work on it with them. Does that answer your question, Melanie? Yeah. Okay. Are there any other questions? Anything else that, any other thoughts? I know, I think somebody else joined our meeting. Earlier I had said if you put your email in the chat, I can email you the poster. And I know that I believe it was Melissa that I'm emailing about the IU index. So if anyone else wants specific further resources, um, more than welcome to put it in the chat, and I can follow up with you. Okay, so the important takeaways for today is that, anytime there's an anxiety disorder, or a child or adolescent presents with anxiety or other mood problems, it might be very beneficial to do a IU index and assess for level of IU. And if you do find that there is a high level of IU, targeting that, making that a treatment target could increase the efficacy of your treatment. And doing that using modular CBT is thought to be an effective way to do that. There is some evidence for it. However, more research is being done. More research is also being done specifically around how IU, is related to depression. It has also been found in eating disorders, autism spectrum disorder, and OCD. Those three are, generalized anxiety disorder it's found the highest there, but OCD, ASD, and eating disorders are some of the other disorders where it is found to be pretty high in those. And then if you do have a child or adolescent that comes in and they do have a chronic medical condition, keeping that in the back of your mind as far as, IU may be something that might be contributing to some of their problems. And then with COVID, right? So we talked about earlier, not forgetting about COVID. It is a very important factor, and a lot of kids are still very uncertain about what things look like after COVID, and especially in children with chronic medical conditions. Not knowing whether they're safe or not, whether they're going to get exposed to something that may be very hurtful to them through COVID. I think I'm done rambling. I really appreciate everybody for listening to me talk for the last 45 minutes. If anyone does have any further questions, I'll stay on for as long as people have questions. And I really appreciate y'all for listening. And I will be emailing anybody who put their email in the chat and following up with you. So thank you.
Thank you so much.
If nobody has any other questions, I'm going to go ahead and end this session. Again, thank you so much, Andrea, for presenting. And I hope everyone that wanted to had time to put their email in the chat so that you can get the information from Andrea.
Cassandra, can you wait just a second so I can get their emails off the chat?
No problem.
Thank you. Sorry, I stopped sharing because it wasn't allowing me to do it. So now I'm able to take them. Sorry, one more minute. Okay, I have it. Thank you so much, Cassandra.
No problem. Thank you again.
Okay.
Bye-bye.